Hi everybody. Thought we'd talk today about arterial aneurysms of the brain along with some other brain injuries. I wanted to show this picture first. This is the brain. This is the internal part of the brain along with the back of the brain. And then where all these excuse me, all these blood vessels are up here, you can see them up here. This is where basically the rest of the brain would be underneath all these blood vessels, and these blood vessels go through the brain. Unfortunately, any of these arteries are susceptible to some sort of an aneurysm. And if you remember from the previous video I did, an aneurysm is a bulging of an artery. So like let's say this artery got bigger and then bigger, and in some cases they burst and there's a bleed. So the blood can pool right here, and when it does that, you have to remember that the brain is an enclosed structure inside the skull. There is no room other than a very small amount between the skull and the brain. So if you have too much blood form, it will start to crush the brain in the direction where the blood is flowing. So as that happens, obviously you can lose blood flow to a certain area of the brain and have a stroke. So maybe this area of the brain you have a stroke. Obviously that is not a good thing, and when a stroke occurs in that area, it's usually because of a blood vessel breaking. So I'll show you some of those. First, I wanted to show you what a normal brain looks like if you were to remove it from the skull. So you can see all these crevices that are inside the brain, and the brain tissue itself, which is very twisted, and it's pretty amazing looking. You wonder what's going on up there when you see it, because each section controls a certain part of the body, and they still don't know what all the parts of the brain do. Some people can have a stroke in one area of the brain, let's say it covers this area, and maybe they have problems with, I don't know, walking or speech, or maybe their arm doesn't move as well as it should. They can have contractions where maybe their wrist is contracted upward, but then another person will have a stroke in almost the same area and have different symptoms, different effects from it. So the brain is kind of a mystery still, and even the best doctors who treat brain injuries and brain problems still are amazed at the fact that they don't really know exactly what goes on inside everybody's brain. Here's a picture I got from medicalartstudio.com. I hope they don't mind me using it. It's from 2009, so it's a little old, but it's still very, very useful. So you can see these bulged out areas in the brain that are very typical looking aneurysms. So here's one and here's one. They're kind of called berry aneurysms is what they call them, because they look like little berries coming off of the the vessels. And these things, when they pop, they bleed out to whatever area the blood is going, and if the pressure from the bleed becomes too high, they can like cut the blood vessel right here, not cut it, but cut off the supply of blood to this area here. Obviously if this burst, this vessel wouldn't get enough blood either, so that's why people with brain aneurysms sometimes die quickly, is because the brain is kind of crushed by the amount of blood that gets into the skull and into the brain, and they just pass out and then die rather quickly. Remember what I said about the skull being an enclosed area with the brain in it, and there's just not room for extra fluid or extra blood in there. So the more blood that enters the brain through an aneurysm, the more likely the brain will be kind of crushed against the side of the skull, and when that happens you have damage almost all the time. So, and if the aneurysm is serious enough and big enough and it bursts, you just don't have much of a chance to make it, unfortunately. Surgically, these are very hard to fix if they're deeper in the brain. If they're on the surface of the brain, they can put what they call a medical, or not a medical, but a aneurysmal clip, which is a metal device that kind of clips the aneurysm closed and helps to prevent the aneurysm from breaking. They can do that if they, say the patient's coming in with severe headaches, and they do an angiogram and they notice these aneurysms, so they do surgery on the patient, and they put these clips in, and hopefully that'll take care of the problem and the aneurysm won't burst. So very, very difficult surgery, and you have to have a very good specialist to do it. So okay, this is kind of a shocking picture of a bleed from an aneurysm, which you can see obviously is this area here, and you can also see how the brain has pushed itself outward and has become very, very large, much bigger than this side of the brain where the aneurysm hasn't really affected it. But you can imagine that anything in this bleed area that is being crushed is going to cause some paralysis or some other problem. By the way, I got this picture from Brown Medical School, and again, I hope they don't mind me using it. I'm mentioning them so they know that I just found this and I thought it was a great picture for patients to look at. So I think that this size of bleed is obviously fatal, because they had to take the brain out for an autopsy, so to see where the bleed was. You can have smaller bleeds than this and it won't be as serious, but unfortunately an aneurysm that pops inside the brain is almost always fatal, or at least causes stroke-like symptoms, so and can be very permanent stroke-like symptoms. So now there are other types of bleeds that happen in the brain. One of them is a subdural hematoma, which you've maybe heard about. These are bleeds in the brain on the surface of the brain, and they're usually caused by injury. So someone who is in a bad car accident, who's not wearing a seatbelt, hits the windshield, they can have a bleed in this area if their head's turned a little bit, or if they fall real hard, especially in the elderly. The elderly have real bad time with subdural hematomas when they fall. So if they fall and hit their head, it can be pretty serious because they have a tendency to bleed quicker. But anyhow, this is what happens. It's on the outside of the brain, but it's pushing against the skull, which then, it can't go anywhere else, so it has to push against the brain. And if the subdural hematoma is big enough, then they have to go in and do surgery and remove the blood clot that's causing all the pressure, and also cauterize or kind of burn the vessel that's bleeding, the little vessels that are bleeding from the injury. So it does require surgery sometimes. Sometimes it'll reabsorb itself and the patient will be fine. I had a little one myself years ago when I was a kid playing hockey, and it dissipated on its own, which was great, and I'm not as dumb as I think I am. Well, anyhow, so that's a subdural hematoma. I'm going to show you another picture of one that's in the back of the brain. So this is a CAT scan of a skull. You can see the bone of the skull. It's very thick. That's why they always say that, man, you got a hard head. Well, everybody pretty much does. In this x-ray you can see the brain tissue here, everybody has these are called ventricles, and there's fluid in there, and that's kind of spinal fluid. It goes in and comes out, and it's kind of a reservoir. This down here is a bleed, a subdural hematoma, and this is a sizable one. This would be crushing the brain pretty significantly, and this one would probably require surgery. So this being a CAT scan, it's a little harder to interpret, but you can imagine that this would be a lot of blood, this whole area here in the back of the brain, causing the problem. And this would be from someone maybe falling and slamming the back of their head on the floor, maybe any kind of fall down the stairs, and they just happen to hit their head on the stairs on the way down. There can be a lot of reasons for it, but we do see a lot of these subdural hematomas in the back of the brain. It just seems to be, when someone falls backwards when they faint, especially an elderly person where maybe they stand up too fast and their blood pressure drops real quickly, they can fall forward or backwards, depends upon which angle they're at. If they fall backwards and slam the back of their head on the floor, you end up with a subdural hematoma here in the back of the brain. Other times you can get one in the front of the brain. It just depends upon how the brain is pushed forward or backwards. The brain itself has very little room, like I said, in the skull, but it does have enough for it to shift during a fall or during an injury, where it can slam up against the wall of the skull, and that will cause this kind of a bleed. So that is probably the most common injury to the brain that we see, but this is a good way of looking at it on a CAT scan. So anyways, that was kind of a quick explanation of it. This is not my specialty, but I thought I would explain it so that people who have had subdural hematomas or have just come home from the hospital and wonder what it was, this is what it was. So anyhow, have a good day.